Hi there, my name is Joan and I'm an instructor with the ACCN program. This is part 2 of a 4-part series covering Module 5 materials. In this presentation we will be discussing positive inotropes, which you will recall means they increase contractility of the heart. If you have not already done so, please watch the review presentations on adrenergic receptors, the autonomic nervous system, and determinants of cardiac output. Dobutamine is a synthetic catecholamine with both beta-1 and beta-2 effects. As you will recall from your module readings, dobutamine's alpha effects are negligible. Therefore, the effect on the cardiac output and blood pressure is variable. There may be a rise in blood pressure, but not as significant as you might see with medications such as dopamine. On the other hand, hypotension can also occur due to hypovolemia and more profound beta-2 effects. Dobutamine also has more inotropic effects than chronotropic effects, which reduces the myocardial workload, increased with an increase in the heart rate. These effects and the increase in coronary blood flow make this an ideal drug for heart failure and cardiogenic shock. So basically any disease pathology where the desired effect is primarily the increase in contractility, you can use dobutamine. The dosing range is 2.5 to 15 micrograms per kilogram per minute, with a maximum recommended dose of 20 mics per kilogram per minute. Unlike epinephrine, dobutamine is typically titrated to a cardiac index instead of a blood pressure. Side effects include tachycardia, exacerbation of ventricular ectopy, angina, palpitations, and hypotension. Milrinone is a phosphodiesterase inhibitor. PDE is an enzyme that breaks down cyclic AMP. As these CAMP levels are maintained, there is an increase in intercellular calcium, which causes increased contractility and heart rate in the cardiac cells. The effect of sustained cyclic AMP levels in the smooth muscles of the vasculature cause vasodilation. Ultimately, the effect of milrinone is to increase cardiac output and stroke volume by increasing contractility and decreasing systemic vascular resistance. Milrinone also has a lusitropic effect, which allows the ventricles to relax more fully, improving diastolic filling. These effects make it another suitable agent for the treatment of heart failure and cardiogenic shock. Milrinone has a long half-life and requires a loading dose to achieve steady-state levels. The typical doses range for an infusion range from 0.375 to 0.75 micrograms per kilogram per minute. And like dobutamine, milrinone is typically titrated to cardiac index. Side effects for milrinone, big one, hypotension, because of that vasodilation it causes. It can also cause dysrhythmias, chest pain, hypokalemia, and thrombocytopenia. Digoxin is a medication that has been used therapeutically for many years to treat heart failure. It also has antiarrhythmic properties that will be discussed in more detail in Module 6. Digoxin increases intercellular calcium by blocking the sodium-potassium pump, the effect of which is to increase contractility. It is typically used in the treatment of heart failure, atrial fibrillation, and rhythms with rapid ventricular rate. It is used less frequently these days because of its harmful therapeutic index and side effects, such as anorexia, nausea, and vomiting, blurred vision with that sort of halo vision, cardiac arrhythmias, and confusion. So that concludes this particular presentation. These materials are also discussed on your website. And if you have any further questions, please contact your instructor.